My name is Camille Nielsen, and this is my presentation on my senior internship at the Behavioral Health Center as a marriage and family studies major. So, finding/arranging the internship was actually fairly easy. Um, it kind of all happened so fast. I originally was trying to see if I could do an internship with a social worker at Mountain View Hospital because I work for them. But when I contacted them, they said that they didn't have the resources for an intern at the time. And they actually suggested that I reach out to Eastern Idaho Regional Medical Center, or ERMAC, in Idaho Falls, which is the other large hospital out there. And when I reached out to them, they told me that the Behavioral Health Center takes a lot of students, and then gave me Brett's contact information. So to make it even simpler for future people interested in this internship, you'll just want to contact Brett Nelson. His email's right there. He is the clinic manager for the BHC, and so he is kind of over the nurses, the social workers/therapists, and the doctors. After contacting him and arranging what hours would work for me, which also kind of went back and forth. I originally had hours that I wanted to do, like I wanted to do more weekend hours, just because I work full time. But he kind of suggested that the weekends weren't as busy, and so it's not as helpful for students or for the therapist to have interns on the weekends. And so then I rearranged my hours again. Once that's set, then he contacted Nikki, and she's the intern for the supervisor, or she's the intern supervisor, but she's one of the social workers as well. So you work with her a lot, and then she's also your main supervisor there. And then Sandy, who works for the BHC, kind of like in the admin/security, she clears all students for their rotations, and they'll both email you what they need from you. So it's super simple. Just Brett will let them know, and then they email you. And then the final part is the BYUI HPO medical internship office will email you a list of requirements you'll need to complete before ERMAC will allow you to start. This just includes things like vaccines, a few short courses, a background check, and again, that just gets emailed to you. You don't really have to do a whole lot for that. So it was really simple. Like I thought it would take a couple weeks to get me started, and it really only took like a week. It happened really fast. So responsibilities, you do a lot of case management as an intern, because that doesn't involve working as much with the patients. You still get a lot of time with the patients in the hospital, but you also do a lot of case management. So this involves setting appointments for patients before they discharge. We like to have patients be set up with an appointment for their primary care provider for med management. If they have a therapist, then we'll contact the therapist they already see and get them set up with an appointment for after they're discharged. If they don't have a therapist, then we have to find them one and get them set up. And then some of them will see psychiatrists, and so we'll get them set up with their psychiatrist as well. But the therapy and primary care for meds, and sometimes psychiatrists will do the meds, so sometimes that'll cover it, or we really want them to be scheduled with before they leave, because that's part of the continuation of care to make sure that our patients are stable when they leave the hospital. Sometimes I would have to call about residential housing or getting somebody into like a sober living housing, and those can be trickier. Or sometimes we have to call to get patients set up in what's called an IOP, which is intensive outpatient care. It's similar to the BHC, but they don't live there. So they go 3 days a week, and it's like 5 hours at a time. They're doing like these group lessons and therapy. So it's just really intense kind of care for them that they don't have to live at. And then we do a lot of discharge packets, and discharge packets are just kind of a big packet of, like the information of what brought them to the hospital, Like, was it suicidal ideation, homicidal ideation? Because the three big reasons why people go to the BHC is suicide, homicidal, or psychosis. So they got off their meds and they're kind of like having a psychotic break. So we want people to know why they're in the BHC, what their progress was while they were there, any meds that we put them on or any meds that they are on, and there's psych eval that was done when they first arrived and when they're leaving. So all of that gets put into like a big packet just with all their information, and we fax all of that to whoever is seeing them after. So their therapist, their primary care, their psychiatrist, the IOP, wherever they're going, we want them to have all that information. Other things I did was attended / occasionally participated in family sessions. Sometimes you can kind of tell when you can say things. Other times they're kind of pretty intense family sessions, so you're kind of out of your element, so you're just observing. Psychosocials. So family sessions are when we don't really do family sessions on the adult units. So family sessions on the adolescent units is either the parents are coming in or we're meeting with them over the phone. And it's where we try to focus on safety planning. So sometimes it is bringing up, what's been going on at home. Because sometimes for the teen, part of their safety planning is that they don't always feel safe at home or that they feel like their parents yell at them too much. So sometimes it becomes like a real therapy family session. But we try to focus on how we can make a safer environment for the teen, whether it's, if they tried to overdose on meds, if it's just getting those meds locked up, if it was they thought about strangulation or something like that, just making sure that whatever could create harm to them is locked up or out of the house. So we just create safety plans for that and talk about the coping skills and how the parents can help with the coping skills. Sometimes family sessions would get really intense and really emotional, and you would get into some deep stuff that is really hard to hear. Psychosocials are what are done when they first get there, and that's kind of just going over their history briefly. We don't encourage them to talk about their trauma unless they want to. We don't like force anybody to tell us every horrible thing that's ever happened to them. That's up to them. We kind of just ask just simple, like, have you been sexually abused? And they don't have to say anything other than yes or no if they don't want to. But we just want to know kind of where their history lays. We like to know about their home life, their favorite hobbies, what kind of brought them there. And we just kind of get a big, broad idea of who they are so that we can better create a treatment plan. And treatment plans are just our goals for them while they're there. So we have a goal to bring down their suicide ideation, and we're going to do it by teaching them these coping skills. Or if they have a past of substance abuse, then we're going to work on not abusing the meds, things like that. And we just go over the treatment plans with them and have them sign it and agree to it. And if they're there for longer than a week, then we'll go over barriers to their treatment plan, like why it's not working, and we'll create new goals and have them sign it again. I taught group lessons on both the adolescent and adult units. So you create your own groups. So if you do this internship, you have to be proactive, and that's what they want. They want very proactive, go-getter type students. My first day at my internship, I remember them mentioning that their last intern did a really good group lesson on this specific topic in the book. And I just remember thinking, okay, they really want good group lessons. Like, that's valuable to them in an intern because they all talked about it. And so the first week I started planning out group lessons because I didn't know when they would want me to start teaching group lessons. And so I just wanted to make sure that I felt prepared and confident for whenever it came up. Week 3, Nikki, my supervisor, told me that she wanted me to start teaching group the next week. So she wanted me to start planning. And this was like a Friday, so I was there during groups. And I just told her, I was like, oh, I already have like 3 groups planned. Like I can plan a group today, or I can teach a group today. And she was like, really? She was like, that's awesome. She's like, yeah, like go for it. And she just told me she was like really proud of me for stepping up in that way. And I continued to think of new groups. And just I had by the end of my internship, I had probably 8 different groups that I had planned, and I would just kind of cycle through them. I did group at least 3 times a week, and it was really fun. And I taught different things like boundaries. I had a couple different communication groups, secure attachment. I had one called The Masks We Wear, which was just about like being willing to be vulnerable and show who you really are. And funny thing about that one is one of the therapists, Corey, he loved that group so much that he actually stole it from me after I left. I gave him all the paperwork for it and the lesson plan because he said that every time he saw me do that specific group, he was like, man, that's so much better than my groups. So he stole it from me. I gave him permission, so he'll probably keep teaching that one, which is really, really awesome feeling to know that, you know, these professionals appreciated my work and wanted to use it. And then I would go on unit and have patients fill out simple forms like release of information and something that's called a PHQ-9, which is kind of just like an overview of how they're feeling. Like in the past 7 days, have you felt suicidal? Have you felt depressed? Have you felt alone? And they answer it the first time they come in. And if they're still there at 7 days, then we have them do it again. And if they're still there at 7 days, we have them answer it again, just to keep it updated in their chart of how they've been feeling. These are just some photos. So this isn't all the social workers. There is 8 of them, but 2 of them were, I think, on vacation when I took these. So this was my last day of my internship. So we had a cake for me, and they made me this big banner, which was really sweet. And they all signed it and told me they thought I was going to run the place one day, which was really fun. But Nikki is the one female here. There are other female therapists, but the other 2 that are missing are the ones on vacation. But that's Nikki, and the one next to her in the blue is Ken. And so Nikki works with the adolescents. Ken works with the adults. Thomas in the black next to Ken works with the adolescents. This is Darren in the pink shirt. He also works with the adolescents. Travis works with the adults, and then Corey on the far side works with the adolescents. So it was just a great environment. They were sad I was leaving. It kind of felt weird for me to be leaving, like after being there for 3 months. Corey and Darren in this photo were joking about how they looked more pregnant than I did. So we took a funny photo together, holding our bellies. And they all joked that I have a BHC baby because I was pregnant the entire time I was at my internship. So I started and had no belly, and I ended and I have a big belly. How did I benefit the site? A simple answer, I benefited it in every way. Like taking on case management is a huge one. It, you know, a lot of interns might not enjoy setting up appointments and doing the discharge packets. I did because I felt like I was helping them so much, because it could take an hour to find a single counselor for a patient, which saves an hour for the therapist. The therapists work so hard there. They are there first thing in the morning and they're there later than anybody, because there's so much on their plate to do, and they care so much about their patients that they, like, any help is so helpful for them. Teaching group takes a weight off of their workload, because so there's 4 units, there's 2 adult units and 2 adolescent units. A lot of times the second adolescent unit is closed because the census can just be low. But each unit, there's like 2 to 3 group lessons a day. So doing group takes weight off of them. They still have to be in there to supervise you, but they got to a point where like they've seen my lesson several times, or they just trusted me enough to like they didn't have to worry, so they could sit there and chart notes while I taught. And if a student really asked a question that I felt like I didn't have, like I didn't have the knowledge or the professional background to respond to, I would just ask whoever's supervising me. But most of the time, I went into each group lesson with the knowledge that I know I needed to have, and I never had issues answering questions for the adults or the adolescents when they would ask me. Discharge packets could take hours to complete, which again saves the therapist so much time. I remember I had like 12 discharge packets once, and it took me like 3 to 4 hours. And then you benefit the patients too, just connecting with them and creating a safe space for them. So many of the adolescents like really connected with me, and I don't know if it was because I was younger, but they would come out of my groups and just be like, I learned so much, like I love when you teach. And so that just made me feel so good. And sometimes they would want to tell you things, and I couldn't, I would have to tell them, I'm not a therapist, so I can't give you any advice, but they just felt safe talking to me, and that felt good. How did I benefit personally? What's so amazing about an internship at the BHC? Like I seriously loved it. I learned so much. And it's because you see so many different kinds of mental health. You see so many different backgrounds, so many different people. You see the good and the bad of the patients, the good and the bad of the parents. You see so much like resilience. Because some of these adults and adolescents had just come from such horrible homes. Like you hear these stories, and I would start tearing up, and I would have to like hold back because you have to stay professional. But the way that they would just have this strength about them, and that was just so inspiring. So you learn so much being able to see so many different kinds of things at the BHC, and it's not the same thing every single day. So like every day you're going to be busy going in, every day you're going to learn something new, and you have to throw yourself into it. The therapists have said that there are some interns where like they don't step up, they'll just wait until they're told to do something, and they'll just kind of twiddle their thumbs. But you really have to just jump into it. Otherwise you're not going to get anything out of it. You're just going to waste their time, and you're going to waste your time. You learn so much more if you just jump in. Know that they aren't expecting you to be perfect, and they know that you're going to make mistakes, but that's okay. They'll teach you along the way, and you'll get better. I saw people for who they were and not for their trials. Like when you really hear these people's stories, you learn so you just learn so much of the depth of people. And there would be like adult males who would come in with these scary tattoos all over their arms and piercings on their face, and they would just be like the sweetest people, and they would have like the most inspiring stories and the best comments in group. And so you really you don't know who somebody is until you really talk to them and take a moment to hear them out. I got to put what I've learned at BYUI into action and see it work, which I think is like the best thing ever, to be able to be like, wow, I remember learning this in class, and now here it is, like it's happening in front of me, like I can see how this relates. Like my first day that I got there, Nikki came and got me from the front because I didn't have a badge yet to get in. And she was like, I'm so sorry to do this, but I have a family session. So like, we're just going to jump right into it. Like, you can just sit there and observe. And just that first family session, I was like making all these connections of things I had learned from classes. And it was just so cool. I gained a lot more confidence. Being able to apply my knowledge made me feel confident. Doing the groups was so energizing and fun. And the more you do groups and work with patients, you just feel like so confident when you're doing, like, confident in yourself, but confident that you're making a difference as well. And I gained professional connections. They all gave me like letters of recommendation on my last day. They all said that they were so impressed by me, and they thought that I was one of the best interns that they've had, and that they're just so sad that I was leaving. It was just a great feeling to be a part of something like that. Connection between coursework and internship. I think the biggest thing, so I kept this simple, is that families really are the building blocks for our entire life. The home you come from and the experiences you had as a kid will influence your entire life. Being on the adolescent unit, it's like you're seeing the beginning of it. You can see the beginning of these kids' traumas, or you would hear things that these parents would say, and it would just be like so infuriating to know that a parent could say that about their kid or think that about their kid. And you could see how it was hurting these kids. And then you go to the adult unit, and now these people are in their 30s, 40s, and they're still talking about their childhood, like they're still talking about how they've been led down this path of destruction or substance abuse or whatever, and you're listening to their life story, and you can see that it started from their childhood. So it made me so grateful that, like, I grew up with good parents. It made me so grateful for my education so that I can give my kids the home that they need, like the home that is going to create the healthiest life for them. And so I really truly believe that your childhood experiences and your family is the building blocks of where your life is going to go, who you're going to become. And it's so important that we protect families, so important that we advocate for people who don't have the families that they deserve. So that was the biggest connection that I saw. Would I recommend this internship? Yes, absolutely. You have to contact Brett, but if you're going to do this internship, you need to be ready to jump in and take initiative. We had a couple of interns from other schools, not BYUI. They were graduate level students who did not want to do the work. They were scared to do group. They were scared to call to make appointments. They pretty much would just sit there for hours. And it's not helpful. And the therapists don't want those kind of interns. If you're scared to jump into something like this and jump in early or take initiative or ask, what can I do? How can I help today? And be willing to do whatever they ask you, this probably isn't going to be the internship for you. But if you're somebody who is, I'm not saying that I was fearless. I was scared going into it. I was very nervous. I didn't know what I was getting into. But I told myself that I know they don't expect me to be perfect. They know I'm a student, but I'm going to just try each time. And that was all I had to do, was just keep trying. So if you're somebody who wants to push yourself a little bit further and you're just willing to try and put yourself out there each day, then do this internship. It is great. You will grow so much as a person. You see so much. And don't forget to laugh along the way. The kind of mental health, the BHCCs is hard, and it can be really sad, but learning to laugh with a therapist makes the days easier. They all have a funny sense of humor. We would sit there and we would just crack up about all different kinds of things, and it makes the job easier. So don't forget to laugh and join in with them on the humor and just build connections that way. But that is all. Thank you so much for listening. And I hope if you're thinking of doing the BHC that you do it, and that you learn what you need to learn for yourself for what career you want to go into.